Welcome to Verified RX, your prescription for success. Brought to you by the Vizient Center for Pharmacy Practice Excellence.
Drug diversion is a potential threat to patient and staff safety in every organization. Diversion not only puts patients at risk, but also the organization itself. Dr. Ruth Igwegbe, PharmD, MBA, and Shealee Mitchell, BSRN, with a master's in jurisprudence in health law policy and management, join us today to discuss a unique partnership in building their diversion prevention and detection program. Ruth is the Pharmacy Medication Safety Officer, and Shealee is the Drug Diversion Manager at JPS in Fort Worth, Texas. I'm Carolyn Liptak, Pharmacy Executive Director in the Center for Pharmacy Practice Excellence at Vizient, and your program host. Ruth, Shealee, welcome to the podcast.
Thank you so much. We're happy to be here.
Thank you, Carolyn.
Tell us a little bit about your backgrounds. Ruth, let's start with you.
I'm currently the Medication Safety Officer at JPS Health Network in Fort Worth. I got my PharmD from Ohio Northern University in Ada, Ohio, go Polar Bears, and then proceeded to get training in health system pharmacy administration and leadership at Parkland in Dallas, Texas. And immediately after residency, I came on with JPS working as a med safety officer.
Shealee, tell us about you.
I'm always so impressed with people who knew what they wanted to do when they grew up. I was not that person. I have a little career ADHD and changed careers multiple times. My very first healthcare job was as a pharmacy tech. I thought I wanted to be in pharmacy, and I ended up in bedside nursing. I worked in labor and delivery and multiple other small specialties, and then ended up in the emergency room, nursing administration. Then I moved into policy creation and school nursing, community nursing, public health, in consulting, in executive roles. I worked with the state of Texas in creating some policy for school districts. And then in 2023, I graduated with my healthcare jurisprudence master's degree in law from Texas A&M. Then I moved to this position with JPS as the diversion prevention manager. I'm super excited to be here. I've been here since October working with my partner, Ruth.
Well, thank you both. Ruth, can you give us some background on your diversion detection and prevention program at JPS? Tell us, what did it look like in 2022 and what does it look like now?
Before I get into that, just to paint the picture, JPS Health Network is the county hospital for Tarrant County here in North Texas. It is a 582-bed hospital, trauma level 1, with a psych emergency center. We have a little over 25 clinics spread out throughout the county, and a handful of those various pharmacy services provided. So we have an oncology infusion center, we have an ambulatory surgical center, as well as various retail pharmacies throughout the community. So that's for you all who may not be familiar. And then getting into our diversion program, there has been major strides for our institution. When I first started, within my role, diversion was just one piece of it. I had multiple other obligations and responsibilities, and then there was diversion. We also had various people throughout the organization that participated in diversion prevention. So it was like multiple hands in the pot. Efforts were still developing. So it felt a little bit disjointed, but currently it's a lot more structured. We have a dedicated diversion officer. We have Shealee with us, and she brings consistency. She brings focus. She brings clear follow through with every case that comes up. She's assisted with establishing protocols, having defined goals, metrics for tracking progress. And so it was a good start, but over time, it's now become a well-coordinated program with great leadership support.
And were you originally looking to hire a nurse for the diversion officer role?
Funny enough, no. We were not specifically looking for a nurse. The original posting was geared towards a pharmacist. We wanted someone with diversion experience, someone that had great analytical skills, someone that would be a good liaison between pharmacy and nursing for us. Shealee's background as a nurse and as a pharmacy tech was the perfect mix that we needed for this role and was a very unique advantage. She has the clinical knowledge, but she also connects very well with nursing leadership. It's helped us with collaborating across both departments.
Yeah, Shealee, your background is definitely impressive. Tell us how your clinical background shaped the way you work with teams across the organization.
Having worked in those roles and stood in those shoes is something that I put as a high priority when I'm thinking about the implementation of any process change or any culture change. My goal is to make sure that the teams feel supported and safe. All employee safety, all patient safety is a priority for nurses. I want to make sure that they're involved anytime we make these changes. I want consistency across all units, all clinics, that we're doing the same thing for everyone, regardless of where their practice is located. And I never want to make anyone feel that there is blame assigned. I want them to feel supported rather than someone is watching over their practice. When a diversion alert comes in, we use an AI software to do that. I want to work very closely with nurse leadership to make them feel like I'm their partner. We can use those clinical resource teams, HR, someone from every department to make sure that everything is reviewed, that we have clarity, and that those discrepancies are resolved. We approach it in a collaborative manner so that we have more eyes on it rather than just one person making any individual decision. That avoids unnecessary escalations and nurses being singled out for something that shouldn't be. Maybe they pulled something on one patient that was given to another and it was fine. That drug is actually accounted for and someone is going to find that through an investigation. I also want to engage with the staff so they know who I am. I do that through unit meetings, huddles, training for our new hires. I want to make sure that they understand why this work is important, how it affects both those patient and professional practice, and that patient safety. I never want to just pop out of nowhere and say, we have a discrepancy. I want them to be like, oh, we know Shealee. We've seen her at our staff meetings or we saw her in training. On the pharmacy side, I want to partner with leadership and ensure that we're aligned and reinforce our shared responsibilities and create a culture of accountability, support, and that we're all working together.
I'd love to know more about how your diversion response team evolved. Ruth, let's start with you.
One thing that has been steady throughout the years is we've always had strong support from leadership. That's been essential. There's two sides to it. We have organizational level cadence of meetings, and then we have more immediate day-to-day with our diversion response team. On the organizational level, we hold quarterly meetings with leaders from HR, from compliance, occupational health, pharmacy, nursing, anesthesia. We even have a representative from our police department join those quarterly meetings. And the goal of those meetings is just to make sure that the things we're doing within our program, the changes we're making, continue to align with broader goals, continue to align with the organization as a whole. We also have all the resources needed to grow in what we're doing. The day-to-day core meeting with DRT includes leaders from the necessary or the key departments. So usually someone from nursing, from pharmacy, and depending on the case or what's needed, someone from HR, OC Health as well. The goal of that group is to monitor trends, make process improvements, respond to actual cases that might come up. It's a good balance of having that strategic piece on the organizational level and then having the action and things working and moving forward and responding to things on both ends.
Thanks, Ruth. Shealee, what do you have to add to that?
Every month, we have our diversion response team meetings and we get our multidisciplinary points of view. They're frontline leaders. They're people who can immediately respond to an issue, which is nice. And I feel supported because if it's more than something I deal with on a day-to-day basis and it's something I may need a second opinion on, I can reach out to them and we can brainstorm together. And then when we have our monthly meetings, I present all of our recent data, what everything looks like every month. I also can present national headlines and keep it at the forefront of their minds about how serious diversion can be on a national level. I want them to understand why our vigilance matters, why we stay on top of it, and why it's always at the forefront of our minds. It's part of being a high reliability organization where we're always looking for what could go wrong and we will stay ahead of it. Because if it's happening somewhere else, we want to make sure that we're taking steps so that it doesn't happen at JPS.
Everything that you guys have described so far is clearly indicative of what a strong program you've developed. What advice would you offer our listeners to strengthen their own diversion prevention programs?
Shealee hit the nail on the head when she touched on principles of a highly reliable organization. Two key principles would be being preoccupied with failure and being sensitive to your operations. Being aware of what's going on nationally around us in the country, in the headlines, helps us to know how to identify any potential vulnerabilities or gaps that could potentially come up. We feel that organizations need to adopt that mindset. And just because you don't see diversion happening right in front of your face doesn't mean that it's not happening. Assume diversion is happening, even if you haven't seen it yet. Prevention starts with awareness and just being committed to identifying those vulnerabilities and addressing them in your workflow.
Being focused on what could possibly go wrong is something that nurses can relate to. It's something that we did in the ER. It's something that we did in the OR. That's something that if we give them the why do we do these things? Why do our policies look the way they do? It's like speaking nurse language. It's something that it's important for diversion officers to share with nursing staff so it doesn't look like you're implementing a policy to them that doesn't make sense. It's also important for your diversion officers to get to know your high-risk areas, which is any area that dispenses a large number of controlled substances. Understand how those teams operate. What do their workflows look like? How do they treat their patients? And spend some time down there. Go and work a couple of shifts. Follow those nurses and shadow them. What does it look like in the cath lab? What does it look like in endo? What does it look like in your trauma unit? Follow those nurses, understand why they're doing the things that they're doing. And then when you're reviewing those charts, their charting makes a lot more sense. Why they write the things that they write make more sense. When a medication is missing, those things make more sense. All of those puzzle pieces will begin to click together for you. Also, ask a lot of questions. Reach out not just to the nurse managers, but to the nurse educators and the team leads. Hey, I found this weird documentation. Can you help me understand why this medication was given to this patient? And typically they can give you a good understanding of what that emergency situation looked like. Did that patient come in unconscious, unresponsive, and had to have an immediate intubation? You will start to understand why those charts look the way they do. It is really important for you to understand the why behind the data. It is also, on the flip side, super important for your nursing staff to understand the why. From personal experience, your policies will be more well adopted if they can understand why it's being implemented. They will wrap their arms around it and make it their own and help you and be your biggest supporters. Most issues are rooted in process gaps, communication breakdowns. That is the number one issue. And always approach the work as a partner. You want to be supportive. You want to have their backs. You want to be someone who is there to protect their patients, but also their licensure and their practice. And you'll also be more well received. When people feel supported and not targeted, they're more open to change and your program will be much stronger. I want to do a little brag on our nurses. When you support your staff and wrap your arms around your program, they will be your biggest cheerleaders. One example is our nurses doing a grassroots program of their own, and they have started doing a diversion education in all of their staff meetings. They've created an acronym for diversion that's posted in their med rooms to help them remember everything they need to chart and to help make sure the medication gets from the Pyxis to the patient. And then when they give report, they always ask, have you charted your controlled substances? Is there anything we need to remember about your controlled substances when they give report off at each shift? What's most impressive is that the nurses have taken on the responsibility for the diversion prevention and they're taking care of each other. And I'm really proud of our nurses for making this a priority on each one of their units and taking care of each other. That's exactly what happens when you become their partner and their supporter in this initiative.
This is all great information. We know that diversion happens everywhere, but it's still somewhat of a sensitive subject, and it's not always easy to find the information that you need. So, Ruth, where would you suggest our listeners go to get more information about drug diversion prevention and detection programs?
A great starting point is the ASHP guidelines. There's a self-assessment that ASHP has published that allows you to perform a gap analysis at your institution so you can, in a more strategic and objective way, identify what your vulnerabilities might be and also see what your strengths are and then work with that to build your program. Second, the Joint Commission does have a brief safety guide on diversion that has some really good information there, as well as the DEA. There's a manual on controlled substances that the DEA has published, and it comes with some recommendations for decreasing the risk of diversion. And just remember, national reports continue to show that the methods used for diverting continue to evolve, so it's important to stay ahead.
Yeah, those are great resources. Shealee, what are some nursing resources that would be helpful for pharmacy leaders to know about?
Number one, the ANA, the American Nurses Association, puts out a lot of information on drug diversion specifically. Their website's great. It's super user-friendly and able to find not just education, but also information and research on drug diversion within nursing. They recently did a study on diversion in nursing. Very interesting read. Also, whatever state you're in, and if you deal with diversion and nursing units, know what the Board of Nursing for that state requires of nursing practice as far as dealing with controlled substances. That is a big missing piece from multiple different areas. Any nursing leader, any nurse that's practicing, and especially any pharmacist that's doing diversion work should be aware of nurse practice guidelines, easy to find on the Board of Nursing website for any state.
You make a really good point there about the state boards of pharmacies and the state boards of nursing. And I know you guys reside in the state of Texas, but there's a lot of health systems that cross state lines. They have that added complication of having to look at different state boards. Thank you, Shealee and Ruth, for coming today and sharing your thoughts and your insights around this really important topic. It's been great chatting with you.
Thank you so much.
Thank you for having us, Carolyn. This was fun.
Join us for more Verified RX podcasts. Subscribe today. Like us. Send us your comments. We'd love to hear from you. Verified RX is a prescription for success and is brought to you by the Vizient Center for Pharmacy Practice Excellence. Thanks for listening.